In the lush green village of Nkumba, Wakiso district, south of Uganda's capital, Kampala, lives Gonzaga Ssentongo. 1 mile at a time, the 28-year-old has spent 6 weeks of lockdown, cycling at least 45 kilometers daily, collecting and delivering antiretroviral drugs, ARVs, to the people living with HIV in his village.
According to the government presidential directive, President directed that there is no movement of public means like transport, there is no movement of this kind of taxis. And right now, we have people who are living with HIV, AIDS. These people, they have to get their medication, ARVs, but they don't have any access to their hospitals. So right now, as a volunteer, you come in and you pick their cards, you go to where they are supposed to get the medication from, their ARVs, and you bring them and to their nearby homes. Since these people are vulnerable, they are sick, they are weak, they can't walk. On top of that, there is no public transportation. So I had to ride my bicycle in order to go and pick their ARVs.
To restrict the spread of coronavirus, Ugandan President Yoweri Museveni issued directives to lock down the country just over a month ago. The directives suspended the operation of all public transportation, including private cars. The only exception are essential service providers and food markets.
That is why we have decided to take additional measures as follows below. Measure 1 is to prohibit all people-to-people movement by everybody, including those using their private vehicles, boda-bodas, tuk-tukus, etc. Why? 2 reasons. Number 1, some private car owners have turned their cars into taxis, transporting the 2 people we had permitted, assuming that they would be members of one's family, when in fact they were passengers being charged an exorbitant fee.
With coronavirus still active in the country, more than 63 families are now looking to Gonzaga to bring them their life-saving drugs. Some days, he covers between 50 and 60 kilometers on his bicycle before returning home.
I'm HIV-positive person, and I take my medication in Reza. This lockdown has really blocked the transport ways on my side as an HIV person, that I cannot move from here up to Reza to get my medicine. The distance from the landing site up to Reza, it is really long, that it can take me even like 1.5 days to reach there. I'm very grateful for Uncle Gonzaga from New Dawn, who helped me to go to Mount get my medication by using a bike.
Among Gonzaga's beneficiaries are children living with HIV. In this homestead lives Nancy, a 7-year-old girl, and 11 other people. Nancy was born positive and her parents died of AIDS. Since losing her husband about 10 years ago, Edessa Ndagire single-handedly takes care of 7 grandchildren and 4 children of her own. This family survives largely on farming, and the little children are able to go to school through sponsorships. With the limited resources available, Nancy's grandmother is unable to trek to the hospital.
We were
faced with a real challenge. At one point, when Nancy's medication was depleting, I wondered what I would do because I am unable to walk with a sick leg. I asked Nancy's elder siblings if they would be able to walk, but none would. As we were debating how to ensure Nancy replenished her drugs, God sent Gonzaga our way, who I now take as a son. He asked for Nancy's medical records, and when we gave them to him, he left on his bicycle. He returned with Nancy's drugs. I was very happy because I knew my granddaughter would be fine. It was a very hot day when Gonzaga returned with the drugs.
But not only does Gonzaga bike long distances every day, many of the roads leading through the villages are not paved. This often poses a huge challenge in bad weather and reduces how much he can accomplish in a day.
On that kind of bicycle, which is really now too old, it has no brakes, it has no like this kind of warning, whatever signs that are moving, you get out of my way. So you have to use your own mouth to whistle, hey, you move away, I'm going this. So it's a bit hard for that in that respect. Another challenge, when you go to hospital to correct those ARVs, they may give you ARVs when they have changed, like the nature of the bottles, because these tablets are put inside the bottles, as you also see them. So they may change just the color, slightly the color of the bottle. But it went to the same manufacturer. When they make little change and you come to the patient and you give that person the ARVs you've corrected from the hospital, if someone notices just a change in the color of the bottle, someone gets alerted and like, this is not the medicine I've been taking. They can do harm to my life. Therefore, I cannot swallow them. However much you've helped this person all the way, that long journey, you've been sweating, you are so tired and all that, someone says, I cannot swallow them because they are really different. I feel like you are falling into a state of unconsciousness from exhaustion and say, all the way, now someone is rejecting the drugs, so you have to go back.
But despite the long distances, difficult roads, and sometimes bad weather, Gonzaga vows not to stop assisting people living with HIV.
I know when even the lockdown is lifted or when it's removed, I know there might be some other challenges. For example, taxis are supposed to carry 14 passengers, but because of the situation, they may say that a taxi is supposed to carry for 12 or half 7. So for that, in that respect, I know some patients, they will not be able to access that kind of transportation in order to go and collect their ARVs. So in that respect, I will still, and even more than willing, to help those ones who will not be able to go and pick their ARVs until the situation normalizes.
And as the deadly coronavirus continues to infect and kill many people globally, HIV patients appeal to not be forgotten by governments.
I would say that world leaders don't forget about, as we're fighting corona, don't forget about HIV-positive patients, because we also need the medicine. As you broke the loads that we cannot move and get our medication. Now, if you can help us, tell the health centers to transport the medicine door to door where the HIV patients are, that will be very, very good.
yali bw'otomuwanga anyiiga.